I've set out to investigate this particular illness myself. The thyroid gland is a bit like the accelerator pedal on your car. It produces hormones that speed your metabolic rate right up. If that doesn't happen, then your metabolic rate will slow right down. And it's a finely tuned machine. First, your body needs to produce what's called thyroid-stimulating hormone, or TSH, which tells your thyroid to get working. Next, your thyroid releases hormones into the blood, mainly one called T4. Later, T4 is converted in our tissues to T3, the active hormone that revs up our metabolism in our cells. But sometimes the thyroid doesn't produce enough hormones. This is known as hypothyroidism. The result is normally a slower metabolism. Now, it affects around 1 in 1,000 men, but it's more common in women, affecting around 1 in 50. Sufferers put on weight and have other common symptoms, as Jo Parker experienced.
The most prominent symptoms were the fatigue and the cold. Other symptoms were hair loss, migraines 5 days a week, low mood. I wouldn't say clinical depression, but low mood.
Jo's symptoms were caused by an underactive thyroid, but getting it diagnosed was a struggle. And there are thousands more women in the UK with symptoms like Jo's who feel they haven't been properly diagnosed. One of the problems lies in the way the activity of the thyroid is measured. If you have symptoms of hypothyroidism, your GP will test your blood. The telltale sign they're looking for is high levels of thyroid-stimulating hormone, TSH, together with low levels of the main thyroid hormone, T4. It sounds straightforward, but it isn't. What are considered normal levels of these hormones varies around the world, and the threshold for diagnosis in the UK is higher than many. Dr. Anthony Toft is former president of the British Thyroid Association. He thinks the test results are sometimes interpreted too rigidly, and that results which fall just within the limits of the normal range can merit further investigation.
If the T4 is right down at the lower limit of normal, the TSH is up at the upper limit of normal, that's suspicious. That's the prompt to take it a little further. I think the trouble is there isn't enough debate about the interpretation.
If you are diagnosed with an underactive thyroid, then you will most likely be prescribed a synthetic version of T4. This works for the majority of patients, but in around 10% of cases, the symptoms don't improve. One reason might be because some patients can't convert T4 into the active hormone T3. T3 hormone in tablet form does exist, but price is a problem in the UK.
The cost of T3 has escalated incredibly. It's now about £300 for a 2-month supply of T3, whereas it costs pennies to make.
So if I go along to my GP and ask for T3, there's a good chance they'll say, no, it's too expensive.
Yes.
There is a less expensive thyroid supplement taken from animals. It contains both T3 and T4 hormones, but it isn't licensed in the UK. So do you think most patients should have T4 and T3?
I suspect that in time that's what will happen. The trouble is the evidence base is not as strong as we would wish it to be, but I suspect it will be a long time before we have sufficient evidence.
Many doctors won't prescribe T3, and there are patients who choose to buy pills online from abroad. Self-medicating is always risky, and taking T3 in large doses may cause side effects in the long term, such as heart problems. But like many women, Jo has accepted these risks.
On balance, I think I will go with what I feel the best. If I'm at an increased risk of anything, at least I'm living my life to the full, rather than being locked indoors, overweight, cold, not able to function mentally.
Have people suggested to you that this is simply the placebo effect?
I can only say one thing. If it is a placebo effect, I am the best I've been in all my life, and shouldn't that be good enough?
The diagnosis and treatment of hypothyroidism is tricky. The same symptoms can be caused by a number of factors, such as stress, depression, and a poor diet. If you've had a blood test and results have come back normal, then you can investigate it further. But you may also have to accept that medication is not for you and that lifestyle changes may be more appropriate. To find out more, do visit our website.